The following is a paid program and does not necessarily reflect the views of WSIC.
Fit, active, healthy, happy, enjoying the prime of your life. Looking out for your health and wellness, this is Health Talk with Fred Lowry from Lowry Drug in Statesville. Call now to ask Fred your health questions, 704-873-1400, 704-873-1400. You can also visit Fred at his store, conveniently located on Hartness Road in Statesville.
Good afternoon. This is Fred Lowry, pharmacist and doctor of natural medicine, and this is Health Talk. This episode is pre-recorded for Friday, February the 28th. Here with the fabulous Joe Berg, producer here. He's helping me be a better broadcaster. This program is intended to share knowledge and information based on my research and experience. It's not intended to offer individual advice, nor does it replace a one-on-one relationship with a qualified healthcare professional. Your daily choices are yours and has more to do with your health than anyone in the healthcare field. My hopes are that this show will empower you with knowledge to take a more proactive approach to your health. Some of my sources include, but are not limited to, various news feeds, health feeds, Epic Times, Mercola, and PubMed. First topic of the day is statins. We've talked about statins. These are medications to reduce cholesterol. But there was a new study that came out that demonstrated that statins seem to raise the risk of glaucoma. So glaucoma is a serious eye condition that can damage your optic nerve, obviously the connection between your eye and the brain, can lead to irreversible vision loss and often blindness. This is linked to the increased pressure known as intraocular pressure. So this increase in pressure can harm delicate nerve fibers in your optic nerves. Obviously, these nerves carry information to your brain about the things around you. There are different types of glaucoma, but the most common is the open-angle glaucoma. This type is often slow, painless, there's no real symptoms, which makes it particularly dangerous because you may not know it until you have vision loss. Some factors for this include age, a family history of glaucoma, higher intraocular pressure, but as stated before, the research now reveals another risk factor, which is the use of statin medications. Quick bottom line here is if you are taking statins, then you probably should have yearly eye exams just to keep an eye on this. So statins work by blocking an enzyme in the liver that's responsible for producing cholesterol. Of course, you have dietary cholesterol, and your body also makes cholesterol, which is a clue that it is very important. So this study this year, published in Ophthalmology Glaucoma, examined almost 80,000 people over the age of 40 who had high cholesterol. They were doing this through electronic health records and analyzed the relationship between statins and the occurrence of glaucoma. They found a notable association between statins and an increased likelihood of getting glaucoma. The statin users had a 13% higher chance of getting glaucoma than those that didn't. There is more to that, but they also found that there's a link between statins and glaucoma was stronger in people with optimal cholesterol levels. So those with optimal LDL cholesterol that use statins had a 39% increased likelihood of glaucoma. That's a big number. The key question is whether the duration of statins play a role in this. So there are a number of studies that substantiated that. An Australian study looking at statins for more than 3 years had a 12% higher risk of developing glaucoma. So once again, regular eye exams are important. When we take a broader look at the statins, some people commonly experience muscle pain and weakness, a condition known as myopathy. These muscle issues probably stem from mitochondrial dysfunction. And the other thing could be an alteration in muscle protein. But the mitochondrial thing is a big deal, and I think that's become a giant focus of integrative medicine and natural medicine, is trying to maintain good mitochondrial function. There's many things that does help that. Statins also has an increased risk of getting type 2 diabetes, cataracts. It has some neurological issues. One of the things that happens related to these statins is it depletes CoQ10, so your body's not able to make the enzyme necessary to make ATP energy in the mitochondria on a cellular level. A 2024 Lancet study confirmed that statins increased the risk of diabetes, particularly high-intensity statins, by 36%. That is another big number. Statins have been associated with an increased risk of hemorrhagic stroke, as published in the scientific reports, and also increased risk in pancreatic cancer. I'm not sure the connection there. So one of the things to do is if you're taking a statin, do make sure that you are taking a product called CoQ10, ubiquinol. The dose is usually 100 to 200 milligrams per day. Cholesterol is a vital substance in your body. It also plays a role in creating vitamin D. It also helps protect your nerves. The sheath around your nerves, called the myelin sheath, which is damaged by many things, heavy metals, aluminum, spike proteins, mercury, that type of thing. I think that one of the focuses here is on overall health, and sometimes we get over-focused on a particular number of cholesterol, but there are a lot of factors here related to heart disease and cholesterol levels. Cholesterol is so important for many things, for your brain. It's one of the precursors for making hormones for men and women: testosterone, estrogen, estradiol, progesterone, DHEA. It is important for making your cortisol, which cortisol gets a bad rap sometimes as a stress hormone, but cortisol is also vital to your health and in maintaining so many things related to body function. So it's something to keep in mind. So as a quick recap, if you're taking a statin drug, make sure you're going to see your eye doctor. Stay tuned for more health talk coming up on the hepatitis B shot recommended for pregnant women. Stay tuned. Welcome back to Health Talk. This is Fred Lowry, pharmacist and doctor of natural medicine. So I know I've been talking a lot about vaccinations lately. It's certainly in the news a lot more, maybe more focused because of Kennedy's appointment. Of course, we've had focus because of the past COVID shots. I've noticed more things on Facebook related to this, and one of the things that interests me is it seems like there's maybe three groups of people, and this shouldn't come as a surprise to anyone. Those that just are not going to take any vaccines, those that will take every vaccine, and there are many in the middle of that. And so as we look at that, the term that's been coined apparently is the vaccine-resistant movement. So there's people all across the board with that. And if you've always believed in the concept of vaccination, which I don't necessarily disagree with the concept, perhaps the implementation is problematic. And the other thing would be when we have vaccine injury, and I think many people have seen that. I have a little more opportunity perhaps to see that in my world. But, it's one of those things that you just kind of need to figure out for yourself. And I ran across this, I had mentioned this before. This is related to Gardasil. Gardasil is the vaccination against human papillomavirus. And there's a current lawsuit going underway against Merck in Los Angeles. And the title of this article was that the Merck and the FDA knew that Gardasil HPV, human papilloma vaccine, was contaminated with DNA. So these were apparently declassified documents related to the trial, revealing details about Merck's failure to conduct a safety test. That Merck knew Gardasil vaccine was contaminated with human papillomavirus DNA fragments from the manufacture process. And so there's concerns about that. There were concerns about that related to the COVID vaccine, something called plasmid DNA. And what that is think about it as a fat that carries these DNA fragments into the body and into cells, which means there could be a risk of that incorporating into cells. 2011, Dr. Sin-Hang Lee, pathologist, discovered high levels of human papilloma DNA fragments in 16 Gardasil vials from several countries, including the U.S., New Zealand, Australia, Spain, Poland, and France. And it did have these plasmid DNAs it was supposed to be removed during the manufacturing process, but that didn't happen. This DNA can trigger pro-inflammatory responses and apparently be a problem for people with a genetic predisposition leading to autoimmune disorders. The package inserts make no mention of this DNA in the product. We all know that there's been many vaccine injuries. Well, maybe not everyone knows that, but there are a lot of vaccine injuries related to this product. And I would encourage each of you that have interest in that or are considering that for your child, your daughter, or son, to make sure that you look into that. Just do a search on vaccine injury Gardasil. It's rather horrifying. Also of concern to me recently is there's a new hepatitis B vaccine that's been recommended for pregnant women. Of course, that sparks debate anytime you're vaccinating or putting other products into a woman that's pregnant. And this is, I don't know how they go about this, but even in determining the stage or the time in the gestation period of a woman, this is developmentally. There are times that any type of chemical contamination including herbicides, pesticides, hormone influences, endocrine disruptors, can greatly influence the development of a fetus. Of course, hepatitis B is a liver infection that's transmitted through the contact of body fluids and or IV drug use. So mothers with chronic Hep B infections obviously can transmit the virus to their child. The CDC recommends now that this new hepatitis B shot be administered to pregnant women, which I think is quite problematic. The point of concern here is there's little limited safety data specifically in pregnant women. The Children's Health Defense Organization in 2024 said that the CDC added this brand new hepatitis B vaccine, is Hepslav B, to administer to pregnant women. And they removed the language that hepatitis B was not recommended in pregnancy due to the lack of safety in pregnant persons. I did pull the package insert. The one that I saw had not removed that. So there is obviously limited safety data for use in pregnancy. And there's also no adequate or well-controlled studies for this product in pregnant individuals. So it's difficult to maybe assess the risk, but I think it's certainly a problem. The CDC now recommends a lot of vaccines during pregnancy, including the flu, and hopefully that's not a multi-dose vial of flu, because that one still contains mercury. COVID-19 shot, Tdap, which is tetanus, diphtheria, and pertussis, and RSV vaccine. That's a lot of product to put into a pregnant woman. I remember years ago, everyone was just so careful about even taking Tylenol when a woman was pregnant. So we have multiple vaccines during pregnancy, limited research. I certainly have concerns about the safety here. You would have to certainly consider safety when you don't know what's going on with that product and hasn't been tested. But despite this, it's been added to by the CDC on the vaccination schedule. As a side note, the CDC now recommends approximately over 200 shots over an individual's lifetime. In 1983, the CDC recommended just 11 doses of 7 vaccines. There were no vaccine recommendations for pregnant women before 1986. Of course, once Congress passed the National Childhood Vaccine Injury Act, which in '86, which removed vaccine manufacturers from having liability for vaccines. Of course, that could be looked at as a green light to make more and recommend more. So, going back to hepatitis B, we've said, it's basically through high-risk adult behaviors. I'm not sure what the risk is to a child in that case, unless the mother had Hep B, and if she does, then the baby already has that as a concern. So this is about really making informed choices about what you want to do in terms of vaccination for yourself and your child in the future. Coming up on a break, but I found something that I found fairly disturbing, and that was one of the adjuvants in this particular shot that has a connection with cancer. It's called CPG, and it's supposed to elicit an immune response just like aluminum does, which is why aluminum is put in vaccinations. But we're going to talk about a little bit more about that and the specifics of what the manufacturer of this product has put into this shot, which I would encourage people. You probably maybe too much, but if you pull a package insert of any vaccination and go to item number 11, it tells you the things that are in the shot. And I'll tell you, many times I have to look and say, what is this? I don't know what it is, what it does, which happened with this particular item. Stay tuned for more. This is Fred Lowry, pharmacist and doctor of natural medicine, and this is Health Talk. Welcome back to Health Talk. Lowry Drug on Hartness Road in Statesville was established in 1959. We're a traditional family pharmacy with a state-of-the-art compounding laboratory. We offer a full line of medical equipment, supplies, including CPAP, scooters, oxygen, lift chairs. We have a full line of supplements, nutritionals, herbs, essential oils, homeopathics, and more. Come see us. I think we, as a company, certainly appreciate your local patronage, particularly when we have products that are available for you. And the products that we have, I will mention, are MAP pricing, which means same as the internet. So come see us. We were talking about the concept of vaccinating pregnancy, particularly hepatitis B. And most of you, or many of you, know that listen to this program that a child is also, infant is also vaccinated with hepatitis B on the first day of birth. So that is questionable to me and has been for many years. In this package insert, this is from the drug manufacturer. It does say that all pregnancies have a risk of birth defects, loss, and adverse outcomes, but there are no adequate, well-controlled studies for this having trouble pronouncing this, Hepatitis B for pregnant individuals. The interesting thing is, in the formulation of this, they're using this CPG, which is two proteins with a phosphate on a chemistry standpoint, cytidine phosphoguanosine. This is a DNA analog. It mimics bacterial DNA and is supposed to stimulate an immune response. This is a synthetic chemical, and this is one of those things that I had to think, well, what in the world is this? So I looked it up, and by the way, this particular, as far as I know, this particular adjuvant or additive to this vaccine this is the only product that uses this. So this is an upcoming adjuvant to stimulate an immune response. So one of the things in vaccine manufacturers they learned many years ago, and this was in the first very early days of vaccination, is in order to get an immune response, they have to put something in there that stimulates the body, something that is foreign to the body, so that it will stimulate white blood cells to come to the area and create an immune response. So it's kind of like you put something in the body, and this stimulates this. The body says, this is not supposed to be here. We've got to do something about this. And so aluminum was a major adjuvant, still is. These are nanoparticles of aluminum, not the same as if you take an antacid that has aluminum in it by mouth, although that's maybe not a great choice either. but it's different when you put nanoparticles in the body by injection. And this aluminum is picked up by white blood cells and goes anywhere in the body, including in the brain. And so that's the negative side and one of the mechanisms for possible harm with vaccines that include this. But this, to me, is a mind blower. This CpG methylation, when it gets methylated, which means a chemical group is added to it, it affects gene expression, the expression of your genes. So it's a major factor in the development of cancer and its progression. This particular synthetic material is a synthetic form of DNA that mimics bacterial and viral genetic material. So there is actually CpG methylation testing that can help detect tumors and predicting outcomes, and so sometimes they use that for determining what the treatment for that cancer should be. So I looked a little deeper on this. In 2017, there was this thing about DNA methylation, the adding of a methyl group in chemistry, associated with prenatal mercury exposure and cognitive performance. So this persistent methylation, genetic methylation, has been a problem. This is also associating another gene called PON1 that apparently is only in boys, and that particular gene may modulate mercury toxicity in human beings. So, as we know, boys are more susceptible to this type of toxicity. I'm going to try to make this as clear as possible because listening it may be a little confusing. So this CpG, this adjuvant, that's in the shot. There's many binding spots on DNA where cytosine, being an amino acid, and guanine are there. So this CpG is separated by this phosphorus connector at the sites that are on this DNA are used by the cell to regulate the expression of the genes. So this interferes with, how genes are expressed. Now we know that there are epigenetic factors, which means environmental factors that influence gene expression and can turn on good potential of your genetic material and turn on the negative as well. So these sites, they're called CpG islands genetically, and they're found at where the transcription starts. And these sites are on about 70% of the genes. So what we've got is this adjuvant that can have an influence on approximately 70% of the genes. That number doesn't sound right to me, but nonetheless. So when this site is methylated, this methyl group, chemical group, comes on. The expression of the gene is silenced, so it doesn't have an impact. When it is unmethylated, the gene expresses itself. So many cancers, it's relevant to cancers, which often have this hypermethylation mechanism. So it's methylating more things, which basically it's a tumor suppressor. So when you have this site methylated, you're suppressing the ability for your body to know that we have a genetic problem here. Need a sip of water. Pardon me. So what it's doing is interfering with the body's ability to recognize a cancer gene and deal with it. So this hypermethylation of cancer, we're suppressing our own cancer suppressing genes, and so this is certainly can have an impact on pregnant women. We don't know what it's doing to the fetus. A little more on this when we come back, coming up on a break. This is Fred Lowry, pharmacist and doctor of natural medicine. Thank you. Welcome back to Health Talk. This is Fred Lowry, pharmacist and doctor of natural medicine. Thank you for listening. We're doing a little deep dive in this CPG, this complex event in the body that. So we're putting an ingredient in the body that can have detrimental effect, including cancer. So the process of an infant developing the neurodevelopment is very, very complex, and a cell's ability to turn on individual gene expression, turn off. This seems kind of interesting in that we potentially are maybe dealing with the wiring of this child's brain when we put chemicals in that can affect gene expression. So, and the other part about this is this methylation factor that we've been talking about is a genetic trait for many people. Pardon. So there can be transgenerational effects. Many of you are familiar with that MTHR gene, which there's a problem in methylation of B vitamins. So certainly, I think this is a problem. Going back to this PO1 gene that I mentioned earlier, and as we just keep learning more about this stuff, but this is a thing that may help protect against the damage of organophosphate pesticides. Glycophosphate would be one of big concern here that has been implicated in autism. This PON1 has been associated with autism risk. So all that's a factor. This particular paper was more related to mercury expression. We know that boys seem to be more susceptible to mercury toxicity, and that mercury exposure can cause epigenetic effects, that can be persistent. Years ago, one of the big focuses on the autism thing was the mercury. That was supposedly debunked as certainly a factor, because mercury, the heavy metal, does cause problems with the myelin sheath of the nerves, and indisputable, it's a neurotoxic item. Along the same line, just something to think about, there's the issue of electromagnetic fields. A recent article about that that says that for 50 years regulators have ignored reports linking wireless radiation to 23 chronic diseases. We know that electromagnetic fields can impact us. The question is how, and I think that because something we can't see and we can't feel, we can't touch. It's just one of those things in the background that what are we going to do about that? There was this U.S. government report that they've known for over 50 years that wireless radiation is linked to 23 chronic diseases. So this electromagnetic radiation, there was a report done by the Children's Health Defense Organization that you can access. It's fairly easy to understand. It gives you some of the scientific parameters. There's actually thousands of scientific studies on the biological impact, health effects of electromagnetic radiation. Interesting, the Navy was involved in a lot of this research and signals of 1 to 4 gigahertz. And these type of frequencies are basically identical with all the things that we know about: cell phones, Wi-Fi, Bluetooth, smart meters, etc. The Navy's review found 132 different biological effects and symptoms of diseases related to wireless exposures. So some of those are on the fastest growing list of our chronic diseases here in the U.S. Attention deficit with hyperactivity, anxiety, asthma, autism, chronic fatigue, diabetes, autoimmune disease, etc. So think about that your body is electric, and electromagnetic fields can certainly influence that. We've certainly seen a lot more heart-related things, atrial fib in this, and there is an association of that with the former and continued to be used COVID shots. So, there's things to consider. What are you going to do? How are you going to minimize this contact? So you can try to keep your phone on airplane mode at night. Use a Safe Shield on your phone, which is a device you can order on the internet. Turn your Wi-Fi off at night, and/or hardwiring your computer in your office instead of using Wi-Fi. Last topic is urinary tract infections. Urinary tract infections are one of the most common infections in the outpatient setting. Affects a lot of women. It happens when bacteria gets in the urinary tract system. And one of the problems with this, of course, is antibiotic use, and we continue to see a lot of antibiotic use for these type of infections. It's said that antibiotics for UTIs cover about 15% of all antibiotic prescriptions in the United States. That's a pretty big number, maybe accurate. One of the things of concern is over prescribing antibiotics. One of the most common bacterial infections for UTIs is E. coli. Of course, women are more susceptible. Risk factors include being dehydrated, holding your urine for too long, if you have diabetes, so sugar helps bacteria grow. Postmenopausal women experience a lot of urinary tract infections, and if you go to your regular doctor for this, you, of course, might get an antibiotic, but if you go to the emergency room or a urgent care, you're more likely to get an antibiotic prescribed with that. So there are things that you can do. You can use D-mannose, which is a type of sugar that your body can't use, but what it does is it binds to the bacteria in your bladder so that basically it doesn't stick to the wall of the bladder. There are herbal products like Kidney Comp that we sell by Natural Creations. Sometimes alkalizing your urine can be helpful. You can do that with baking soda or Alka-Seltzer Gold. Alka-Seltzer Gold doesn't have the aspirin or other things in it. One of the interesting things is if you have a problem with this, you may want to eliminate this factory farm meats, particularly chicken, because they have E. coli that may have been genetically changed, be antibiotic resistant, so that becomes an issue. Women on oral contraceptives can have issues with UTIs because of disrupting the hormone balance. And then also postmenopausal women, there's been an association with decreased estrogen levels and changes in administration that can lead to more urinary tract infections. So sometimes that is something to look at. Some women use estradiol creams in that. But there are other things you can get over the counter if you have a urinary tract infection. There are cranberry products. You can also get methylene blue, which used to be a product by prescription, but it's a very interesting medication that is helpful in many things. Urinary tract infections as a sidelight. It's also been used for improving ATP and some things. Maybe we'll take a deep dive into that at some point in time. Thank you for listening to Health Talk. We appreciate your listenership, and hopefully we will be back next week. This is Fred Lowry, pharmacist and doctor of natural medicine.